Hey guys, welcome back to Ace the AMC. Today we have a Neuro AMC1 recall question from April 2024. So let's get into it. Remember, the best way is to read the last sentence first. So what is the most likely associated disease? We have the diseases here. So let's go through it. A 24-year-old female presents with worsening right eye ache and reduced vision. The pain is worse with eye movements. There is no redness or fluorescein uptake. Her vision is 6 out of 12 in the right eye and 6 out of 6 in the left. Relevant afferent pupillary defect is present. What is the most likely associated disease? So most important part there, associated disease. So first of all, we need to work out what this woman has. Okay, so this woman has optic neuritis. The biggest key to this question is knowing a relevant or relative afferent pupillary defect is pathognomonic pretty much every time in all questions for optic neuritis. Okay, this is the Marcus Gunn pupil done with the swinging flashlight test. So let's start from the bottom. Optic neuritis secondary to infection. We know this lady has optic neuritis, okay? Secondary to infection, probably unlikely. There's no other signs of infection here. Doesn't tell us her temperature, no other systemic signs, so unlikely to be that one. D, migraine. This is the wrong answer. There's no signs or symptoms of any migraine pain here. There's no scintillating scotoma or any pre-leading event, and there's no mention of any headache. C, sarcoidosis. This is incorrect. There's no systemic signs of any signs or symptoms of sarcoidosis. Sarcoidosis, you also get uveitis and reddening of the eye, which you don't see here. B, Graves' disease. This is incorrect. Graves' disease does affect the eye. Remember, you can get proptosis, which is when the eye bulges out. This is usually bilateral, not unilateral. Okay, and you don't get a relevant pupillary defect. And maybe you'll get other signs of hyperthyroidism, like tachycardia, weight loss, heat intolerance, things like that. And that leads us to the final answer, which is multiple sclerosis, which is the correct answer. So remembering that the highest yield findings in multiple sclerosis are optic neuritis and internuclear ophthalmoplegia. Okay, you can also get things like urge incontinence, and the symptoms are, well, the most common type is relapsing remitting, where the patient will have repeated episodes of neurological disturbances over a period of time. Okay, so what we're seeing here is optic neuritis from MS. Okay, gold standard to diagnosis, if you did suspect MS, would be an MRI. You would see those scattered white lesions everywhere. Okay, and then best way to treat it, or the way to treat it in Australia, is through a mixture of oral and IV steroids. So thank you very much for listening. If you wanted any more videos, please let me know. If you had any recalls you wanted me to go through, let me know. Otherwise, please like, subscribe, all that jazz. Cheers.